Thanks to everyone for joining us. Very excited to be talking about the work that we've been doing collaboratively with Avera over the years, and particularly excited to be joined by Lindsay Myers to share part of that story. We're going to be talking today, well, about a bunch of things. I'm going to start off a little bit with some of the trends that we're seeing in redesigns, both from our recent industry survey, as well as things that we're seeing just as we're talking with and working with organizations across healthcare in the United States today. I'll also talk a little bit about some of the longer term history at Avera. We've been working with Avera for a long time. We opened the vault a little bit and look back a little bit further than most of what we'll be talking about today. But mostly today, Lindsay will be walking us through the creation of their fabulous current website at avera.org. Oops. There we go. In case you didn't remember which one is Ben and which one's Lindsay, this one's me. As mentioned, I am the Chief Strategy Officer at Geonetric. Geonetric's a full-service digital agency helping healthcare brands thrive through effective marketing and distinctive websites. We do CMS, we do hosting, we do marketing strategy, creative services, all of those sorts of things within the healthcare space. And of course, you can learn more about us at geonetric.com. In addition to that, I am the current president of ShushMed, and I hope to see many of you out in Seattle at our annual conference in just a few weeks here. So we'll start off with some background, some things that we're seeing out there in the space, and really some things starting from our annual survey, our annual-ish survey of digital marketing in healthcare. If you want to see all of that, of course, you can get that from our website. We've been doing the survey for a while, and for years and years, we saw more or less a 3 or so year redesign cycle for health systems. 3, maybe 4 years. We would look and we would see about a third of organizations in the process of redesigning a website, about a third that had completed in the last year, about a third that were in the planning stages for the coming year, and that was just what we saw for a number of years. And then some things changed, and when we did the survey, and I guess we published that 2.5, maybe almost 3 years ago now, we'd seen this cycle slow down. And I think there are a number of things that were behind the slowdown. Certainly that was a time of particular uncertainty in the healthcare space. They put the brakes on a lot of investment projects if they weren't absolutely critical at that moment. But it was also following a huge wave of redesigns that came out of the responsive design revolution and the emergence of mobile as a major growing platform for the people that we were communicating with. And so all those things together, that big wave of redesigns followed by a period of uncertainty, we saw a lot of organizations sort of putting the brakes on it, deciding they were going to get a couple more years out of the site design that they had in place. But in this most recent survey that we published earlier this year, we're starting to see signs that that cycle is speeding back up to what we normally consider sort of a normal speed for things. So this was the question where we asked, do you plan to redesign? And you see, 18% in the upper left there had completed in the last 12 months, 20% in progress. And again, that suggests maybe a 5-year-ish cycle on average for hospital site redesigns. But when we looked at the organizations that were in the planning stage for a redesign in the coming year, that was a much bigger slice of things, 30%, which suggests that we may be moving more towards a 3-year to 4-year kind of cycle rather than the 5+ year cycle that we had seen for a little while there. Now, in particular, when we start to dig into the numbers, we saw organizations that were feeling like they were really behind and wanting to catch up, organizations that were found themselves kind of in the middle of the road, but started to feel like, hey, we're in a position where we need to be leading from a digital experience perspective. Those organizations were the ones that overwhelmingly were redesigning. So amongst that group that said, we're behind right now, and we're not okay with that. 70% of those folks we're planning to do a redesign in the coming year. So when organizations are looking to move forward, it seems that in almost all cases, the way they start moving forward is by engaging in a redesign of that core central piece of their digital strategy, and that's their destination website. Now, as we're seeing organizations doing those redesigns, we're also seeing a big shift in the way they're telling their stories. And this really mirrors a lot of what we're seeing organizationally. It's not that the web lives separately from the sort of branding trends that we're seeing within healthcare or the overall operational and organization trends, right? We're seeing a lot of mergers, we're seeing a lot of acquisitions, we're seeing a lot of growth strategies that include really expanding the base and becoming somewhat less hospital centric. Um, Operationally, that's kind of where the industry's at. Branding wise, we're seeing a lot of organizations that are saying we've been maybe a bag of brands kind of organization in the past, and it's just too expensive for us to continue to build up all those brands. And frankly, we are losing to organizations that are bigger and are able to leverage the muscle of their size. So we want to be able to leverage the size of the organization for awareness, for brand building, for those sorts of things, rather than really fighting in many cases against ourselves for share of mind, for share of brand space. And so we're seeing a lot of organizations that really were maintaining many brands under that umbrella really consolidate the number of brands that they're trying to put out there in the marketplace, and sort of moving to more of a system level brand or an enterprise type organizational brand structure. Likewise, the stories they're telling digitally follow that same pathway. And that's very much what we've seen over the years with Avera as well. So many of these entities, many health systems in general, for many years, we would have separate websites for the system, maybe for each hospital, maybe there were sort of regional clusters going on there, maybe for clinics, lots and lots of different sites representing different business entities, business units within the overall enterprise. And we've seen from a branding perspective, organizations moving to a centralized branding structure, and the way we're telling that story has shifted there as well. For a while, we were seeing those shifts go very far, sort of looking at this as a spectrum of different balance points here, very far to the right, where really very little was living at a location level. Very little was happening at an individual facility or region level, trying to tell enterprise stories for everything. We're backing off that a little bit, and we'll talk through exactly where that is. But it's important to recognize that there's no one point in this balancing act that is the right place or the best place for every organization to be. Every organization has to find the right balance point for themselves, but we are seeing this shift more to the right from a place where many organizations, maybe most organizations in healthcare, had been pretty far to the left traditionally. And there's some real challenges with being too far at either end of the spectrum. And I think that's part of what I think organizations are realizing as they're going through these exercises, as they're seeing these things, as they're frankly, trying to find that right spot for things. When things are too segmented, it's hard to get to the things you need. And I think, from Avera's perspective, a good example of this is behavioral health. They have a wonderful behavioral health hospital, really a leading organization in a lot of things that they do. And underneath that, because it had its own site at one point in time, underneath that, they built a huge amount of content, really deep content well for things related to behavioral health. Great resource. But there were also many other places within the Avera system where behavioral health services were available. However, if I was going in the door of the facility down the street that happened to have behavioral health services, I couldn't get to all of that rich content that really demonstrated how big an expert, how deep, how special behavioral health services available through Avera really were. And so you just couldn't get there from here in a lot of cases. Even worse is if the particular facility I had a relationship with, the one closest to me, didn't have that service at all. It was often very difficult for me to find where that existed elsewhere in the system. So it was really, the fragmentation was really making it hard for every patient to access the care they needed. So we see this as really a core healthcare access issue. In addition to that, from a digital marketing perspective, all those different entities are fighting with each other from an SEO perspective. And so, you're often competing with yourself and certainly splitting all of those indicators of quality that Google and the other search engines use to indicate that you should be higher up that list, because you're splitting the inbound links and the content densities and all these other things going on out there. Now, at the other end of the spectrum, when you really consolidate and you only have a single story for everything, and you really have very little going on at the individual facility level or the individual sort of region level, sometimes you do lose what can be an important, unique individual story. If there's something different and unique from one location to another, from one provider to another, that can sometimes get lost when you go too far to the right end of the spectrum. Um, in addition to that, SEO has changed a lot, particularly in the last year and a half, really focusing much more on localized SEO. So if you don't have clear connections between locations and services, so that the search engines can really tell this is something that I can receive at this location, sometimes that can hurt some things from an SEO perspective as well. So the balance point that we're finding more or less with a lot of organizations, if they're there from an operational perspective, from a brand perspective, is to build a single experience, but build out more of what's going on at an individual location level. So health systems in general, again, are less hospital centric. So we don't want everything to live under a hospital, but individual facilities, be it hospitals or clinics or urgent care centers, whatever it might be, do require some content underneath them that kind of lays out what it is that's going on at those particular facilities. And then we end up building what we're referring to as location personas, so that the large facilities like major hospital centers, we're representing them in a way that really works. And then within the same locations directory, giving a scaled down version of that for clinics that's more appropriate for what they're doing in other smaller locations. And so we're doing some different things in that vein. And again, this is something where we do see the balance point being different for every organization. I think, for instance, of Partners Healthcare, right? So there's, Harvard Medical School and Brigham and Women's, and, they've got this portfolio of these huge brands. Those brands are so strong and really tell distinct stories. I'm not sure it makes much sense to try to pull those together to present one kind of a system level story across them, because they really do have a lot to say that's distinct to the individual brands within that portfolio, at least today. Um, most of us are not in that boat though, right? Most of us, if you go to a facility and you're talking about colonoscopies, well, what you have to say about colonoscopies is probably not all that different from facility to facility within your organization. It really makes sense to have one story about that thing, and then just make it clear that you can get to the places that's most appropriate for you to get care from that place. But again, it is a balancing act. You need to look at the regions and campuses and the different structure that you have within your organization to find the right balance point for these things. So with some of those trends in mind, we want to talk a little bit about Avera's evolution. I wanted to talk about this a bit because it seems like I go to so many of these presentations and just, we went in and we did something and we flipped the switch and like everything was different. And we all know that's not really how it works, right? There's a process. It takes time. And for Avera, as an organization, it took a long time to get to the point where they could really tell a consolidated story for Avera as a system. But at the same time, we couldn't jump ahead of where they were operationally, at least not too far ahead of where they were operationally. So if we look back to, I think about 2010 and before, we were running 191 individual websites. And that's the number that I found as I went back into our archives. I think that's actually undercounting it a little bit. But there were a lot of moving pieces. It was all running on one content management installation, but a lot of moving pieces. So there was an Avera corporate website. There were a number of regional sites. They've got a set of larger hospitals that they tend to sort of think of, or at least used to think of as regions within the system. There were many, many clinics and smaller hospitals. And I think even at that point in time, there was upwards of 100 individual clinics, and they had individual websites. In some cases, individual physicians had their own websites as well. And then on top of that, they had a number of sites for specialty service lines or campaign-related sites, things like that. So the total number of sites that were out there was huge, all with individual URLs, all very separate, difficult to jump between those from a navigational perspective as well. And again, that's sort of pre 2010, and then around 2010, we went through redesign. But this is sort of just to give you a sense of the range of things that we were seeing back then. This was the Avera corporate site. There were a number of different hospital sites, and they had at least a similar look and feel for the most part, although what you found there, where you found it, things like that could be very, very different. There wasn't a strong standard in the way that information was put out there. And then just visually starting to see that, as we got down to clinic levels and things like that, there was a lot of variations on the templating, on the visual look and feel, and that gave individual facilities the ability to express a little bit more of the unique personality, but it made it much more difficult to think of them all as one brand as well. And again, with 191 sites, there was a huge range of different things visually going on within that family. So around, I think it was 2010, maybe it was 2011, we launched a redesigned version of this that really rethought some of this architecture. And the goal was to try and pull these things together. And this was really the point where it became clear that operationally, they didn't operate as a single organization, right? And like most of our organizations that have all these moving pieces, individual facilities were incented individually, and so there was a certain amount of conflict between them. They were competing for some of the same patients in some cases. Certainly, there was no single voice across many of the service lines across the organization, those sorts of things. That was normal. It's not that was bad. That's just where they were in their evolution to become more of a system and operate that way. So we pulled things under a single content management system, but from a practical perspective, most of the content still lived under the individual facilities because that's who owned those stories, and that was the place those things could be told. Still, we were able to balance the overall picture of things with that and pulling it under a single site umbrella at some level. It gave us a little bit better ability to interconnect some things between them. So this was sort of the homepage at the top of things, and you could get to the different facilities this way. The individual hospitals had a much more consistent look and feel, and we didn't, break down as much stuff at sort of a clinic level and at those smaller facility levels, but at least we had a more standardized way to put these things together. And this is 3 of their hospitals, but you get the sense of how this thing laid out here. And then within that, this was again 2010, 2011. This site grew and grew and grew over a number of years before the redesign that Lindsay is going to talk about today. So let me hand control over to you, Lindsay, and you should be able to go from there.
Wonderful. Thank you for all listening in today. Sorry, Ben, I'm not controlling, it seems like, but let's see if we can get it to work with us here.
All right, try again. There you go.
Okay, there we go. So Ben did a great job teeing up this topic, and so I'll kind of dive a little bit more during my section into Avera's journey through this and what it was like on the internal side of this to go through this redesign and how we got there. So first of all, you might be wondering, why the Vice President of Public Relations is talking about this. So I'm going to just talk just a moment about our structure here at Avera. So really under public relations, we have a big span of things, and digital is included in that because we really have those technical experts on our team for digital who are working with geometric. We have insurance websites, we have a telemedicine website, and then we have our hospital system website that we're running. And so really marketing on the other side with public relations is my biggest partner in everything that we do. And we're working with them because public relations is so much about storytelling and getting consumers to look at things in a different way. And so that's why for us as a health system, it makes sense to have digital living in public relations with content strategy being one of your biggest digital levers that is being pulled right now. Also under public relations, we have kind of those typical pieces that you'd see: media, video, writers, I also do internal communication, so it works really nicely when you've got something external going on the web to be talking to your employees first and foremost about it, because they're often your strongest champions. And so we've got that under my area. And then I also do community partnerships, so about 600 different partners a year for nonprofits that we partner with for strategic giving and donations. So the Avera health system has really grown and become much more cohesive, as Ben was discussing over the years that I've been here. I've been with Avera about 12 years now, and we're a large Catholic health system in the Midwest. We are sponsored by the Benedictine and Presentation Sisters, and so it's really neat to be able to walk down the hall and talk to our sisters. The mission is really alive in everything that we do, and we try and bring that out in our digital presence too, because I think that really speaks to people as they're choosing different health systems as far as in our area. We have many hospitals that are very rural, so we're really a frontier medicine site. So we have 33 hospitals. A big bunch of those are critical access hospitals that are treating incredibly rural geographies, and we're located in South Dakota, North Dakota, Iowa, Minnesota, and Nebraska. And we do have a full continuum of care that we have. We have everything from birthing to hospice. And so we go through the full life continuum with folks. We have one of the most robust telemedicine systems in the United States. Currently, we're in about 18 different states, and we have just a whole variety of products that we offer through that. Everything from school nurse, that's done through telemedicine, ICU care. We even have a correctional system or correctional facilities system within telemedicine, where we're working within the prison systems to see prisoners as, kind of that telemedicine side of things, so that they don't have to have staff that are working 24/7. We also offer genetic research. That's one of our big pieces that we're kind of working on right now from a website perspective, is how do you talk to the consumer about genetic research and some of those wonderful, innovative things that you're doing, and how does that look and feel to that consumer? And then just because it's not complex enough to have one insurance company, we actually have two. And so we're currently building a new website for one of our insurance products as well right now. So these are just some informational statistics that we had put together when we were starting our web redesign process to help people understand why this is really important. And really with our leadership, we had to help them to understand that, really online is where everything's happening. So 80% of internet users have searched for a health-related topic. 63% search for a specific disease or medical problem, and almost half of all people are looking for medical treatments or procedures online. So they're looking for information out there anyways. So what are we giving to them in that respect, and how can we be a stronger partner to all these people who want to work with us and are looking for care, to give them what they need when they need it, and make that access easy and consumer friendly. And so for us, we were seeing our traffic was really, we still have a lot of desktop traffic, 64%. But when I first came to Avera, really it was about 7% that was mobile, and now we're at, right under 40% of mobile traffic. So that's really nice to see that growing steadily, and every year that changes and becomes more and more with what we're seeing with consumers being able to do. And our old site with Avera was not mobile friendly, and so we needed to really get there with the times and to be where people wanted to be from a device standpoint with usability. We used to see also that one of our top searches on our website was our baby photos. And when we sat down with our team, we were like, is that really where we want traffic to be going? We're like, is there really that much need to look at baby photos? And really, as we dig into this, you'll see that it wasn't so much that people wanted to go there. It was one of the easiest things to find, and something that all of our facilities offered. But we know that people are online. They're using Facebook to post their baby photos. So we've even changed that over time. And many of our facilities now within the last year have even phased out even offering baby photos because, people are just not using it, and it, can be a risk issue for some infants to have photos online. So we've really gone away from that. But now we're seeing traffic going to the places that people want to be. They want to do task-based items on our website. So they're going to our chart and they're looking at their medical information. They're paying their bills online. So that traffic has gone in the right direction for us. This was really powerful for us as a digital team, and also for our leadership to understand kind of this buying cycle that people go through with healthcare, and having them have a deep understanding of how people are consuming healthcare online. And so in 2012, Google partnered with a research firm on how patients use search engines to choose physicians. And so this is really kind of the basic buying cycle and journey that most patients are going through. So they're starting with symptoms, and they're looking for things like itchy, watery eyes, chest congestion, cough that won't stop. All those things that we're typing in ourselves as consumers was what they were doing. And then they tend to move to diagnosis when they start to figure out what they have. So those are terms that they're looking at, such as like Avera hospital near me, orthopedics, and then my town that I'm in, things like that. And then treatment is more looking at those specific, they're ratcheting down that funnel to look for orthopedic surgeons or actual hip replacement, and then we're able to serve up information to them there. And recovery is more around that therapy, swing bed kind of term that they're looking for right now. So that's really what we shared a lot with our leadership, was having them have an understanding of just how people are coming into this funnel and where we can be helpful to them. So we spend, from a pay-per-click standpoint, a lot of our resources are around diagnosis, treatment, and recovery, because we find that most people are not bidding on symptoms because they're using WebMD. There's just so many sources of that information out there. So we try to be present when they kind of get to that diagnosis stage in this cycle. So our old website that we had actually had over 9,000 pages. And if you can imagine, it's like a house that had been added onto and added onto over time. So it was not very efficient. And so we needed to really eliminate that redundancy. So like Ben talked about earlier, there's very little clinical difference between some of the things that we're talking about online. So just one piece that I would use as an example with our leadership was that we had 30 cardiac rehab pages. They were all largely clinically the same, for experience for the patients, but every page was a little bit of a unicorn on our site where it just had some information. But Google was looking at that from us and was pushing our results down further and further. And when we studied it, some of our searches we were like on the 20th page on Google because we had so much redundant information that Google was kind of saying, hey, you're confusing. We're just going to continue to push this down. So we were actually being punished for our redundant information. And so if you're not looking at your website like that, I do recommend taking a look and auditing things, because that's really what led us right into redesign. We're like, this cannot continue. We need to change this, and we have to get the organization to go along with us. So that's really kind of what I'm going to dive into now. So as I mentioned, we're working with our executives every step of the way on this process, but it takes them having an understanding really of what's going on in the digital space with patients and with potential patients, and where they're coming from, how they consume information. So we had a lot of data, and that was very, very important to us because that data helped us to be able to tell that story better. And we also met regularly with our executives, and sometimes we were worried, are they going to feel like we're wasting their time? But they actually loved it and were very, they communicated the information that came from those meetings elsewhere because they found it to be so beneficial. And by the time we got through the redesign, they felt completely bought in, like they were part of that process, and they told that story on their own. And they would be able to reiterate things that we had talked about in those meetings to others. So it didn't, result in another marketing meeting. it was them helping to proactively kind of do some of that firefighting for us. Out of this process, we also developed web governance, which was incredibly important. So how we started that process, for those of you who might be just going into a redesign, is we really said, what are those rules that we know about our website? And those were things around the physician directory, what goes in and what doesn't. And so we started there, and then we kind of just continued to add on to that over time to be able to make that a more rich document. And we tried to not add things that were not, able to be replicated over time. We tried to not add one-offs in there, and only things that were hard and fast rules that we knew in our mind needed to go into a governance document. So this is our website, and this is a visual representation of it. And we worked with Geonetric on content strategy, which doesn't seem like it's going to be really as hard as it actually is to do. But when you're looking at how different things pivot with each other on a website, we actually had to put this on a conference room wall. Jill Jensen with Geonetric was kind enough to come up and help us work through all of this, but to visually represent to people where their pages were going to be so we could show them how it all worked together. I know this is a very non-digital thing to do, but it was incredibly helpful to our team because we have so many different customers and they were at different places in the maturity process with coming into centralization with Avera. And so helping them to understand where their place was really helped them to buy into doing a new website and feeling like they were part of something bigger than themselves. So the reason those are so important, those Post-it notes that you saw, is because our website works together and it needs to be cohesive. So locations are tagged with providers on our new website and services. And that is incredibly complicated when you go into the back end and just trying to decide what rose to a service and what didn't, and what lived under other services. Took us weeks to probably work through that process and really thinking through what are those high-level services that people can get everywhere in our system, and what are these very niche services that need to have an identity, but maybe it lives under somewhere else. And so that took a lot of work with Jill to really talk that through, and she was very good to kind of guide us in that thought process to say, I think you need to go back and have more conversation about this or think deeper about this. So that helped a lot. And then every location page obviously has Google Maps that's available for people to be able to easily find things on mobile, clickable phone numbers. So it's an auto dial phone number, and then it's a longer scroll on our website. Then we chose that versus shorter pages. So those are all decision points that we went through as we were going into this redesign. We also had one events calendar, which, I'm kind of embarrassed that you guys saw all of our old pages. Ben had warned me about that, but I'm just kind of like looking back at them, strolling down memory lane of how many iterations there were, because our team was really trying to work with where the organization was at that point. So we had different event calendars, things just weren't cohesive. So our digital team was so good at cheerleading this because they had gone through all of those iterations and they were so ready to have this come together and be a better experience for our patients online. So there's also, I want to talk a little bit about the I want to area, because as I mentioned, really people, when we did heat mapping and scroll mapping and consumer research with our website as to what's easy to find and what are people really doing online? It was a lot around that task-based piece. They wanted to do simple things like pay their bills, access their Avera chart. They wanted to find a job and apply for that job easily, register for a class. And then those baby pictures, that was one that we had to leave on that top piece when we went into this. So that I want to area was really helpful to be a solution that came out of all of our research from Geonetric, so that they could say, here's really a centralized area where people can do these tasks, and it's available to them wherever they're at on the website as a pop out that they can do very easily at any point. So I'm going to kind of go into now the physician area, because this took a lot of decisions to kind of make this happen. So physicians are tagged to locations and then services. So for instance, if I'm a cancer physician, I'm tagged to my location. It might be Sioux Falls that I'm working in. And then I'm also tagged to cancer at that bigger level. So if somebody is looking for cancer physicians anywhere, they can find me. But then as they ratchet it down where they might want to look for just a specific facility or specific town, they're able to just find those physicians who offer care in those areas. And we have over 800 employed providers and over 1,200 physicians that are practicing at our critical access hospitals and whatnot. So our overall physician directory is over 1,200 strong. So when you think about all that interconnectivity, it takes a lot to think through the governance for that and putting that all together. And then it was very important for our physicians to be able to feel like this website was a big upgrade to them personally. So Avera Medical Group physicians, we studied best practices from a lot of different health systems, and we really found that having a built-out physician bio was incredibly important. So back in the old Avera website, physicians were kind of choosing that they wanted to be tagged to different specialties, and without governance, it's really hard to tell them no. So we'd get a phone call where a physician would say, I want to be tagged to hepatobiliary surgery, and we're like, well, that's not really like, that's very niche, service that should be under something else in surgery. And so now with our new governance, we really use our rules and have worked with our credentialing folks who use Cactus on just using the AMA tagging guidelines as far as what those specialties are. And then in addition, our physicians on their bios, once their specialties are worked out, they're able to have a quote, they're able to have access to their videos. And then I'm going to go into in just a minute our Balance blog. They're able to tag to those pieces as well. So this is our old website as it used to exist. And this is our new website. So this is one services section, women's health, and our homepage area, and kind of how that lays out. So as you can see, as I was talking about, everything kind of pivots around, finding a physician, finding a location, and then we do have our health plan option on our main navigation. But they're able to really center in on which city they want to look for providers in easily within our website. And then last Mother's Day, we actually launched Balance is our blog online. So we were looking for a type of health hub where we could store all the content, because once we got done with the website redesign, we were like, what's really missing is a good house for all that content, because we're talking about on the website what makes Avera unique. We're not talking about the symptomatic things, and we don't want it to be a health encyclopedia. So when we do want to write about health-related topics, where does that content go? And so we worked with Geometric to really design this beautiful health hub site, and it has a lot of functionality to it that was important for storytelling. We wanted people to be able to, use it on their mobile devices, and we most of all really wanted it to be searchable. And so it actually has its own search functionality that lives within Balance, and they're able to look for different articles, and then they can ratchet it down even more from there, where they can get things that are just like the latest technology, just recipes, or they can get just recipes about cancer. And so that's all based off of our taxonomy on the back end of the website that our digital team is going in and tagging things so that they're tagged appropriately so that your search functions very well. And so these are all things that you have to think about way far in advance of redesigning your website and start making decisions on it, so that when you go into the design process, it is a good, smooth experience for you and your team to be able to work through. Here's another example of how a blog lays out on Balance. This is from one of our bloggers, Jessica. And then also we have an e-newsletter, so a beautiful email template that also functions off of what we built for Balance. And so that goes out twice a month. We do post at least once a day in Balance. We just have lots of content. And so content doesn't ever just live on Balance from a content strategy standpoint, because we're still in a building process. So we're working up to a larger audience, but it also lives either organically on our social, it's part of a paid strategy for our social, or a campaign that we're running for marketing. So we just won an award for our website from Modern Healthcare, and several other awards that I'll turn it over to Ben to kind of talk through.
Oh, I didn't know I was talking through this one.
Oh, I'm sorry. Yeah.
Well, yes. So they've won a number of awards. Most notably, they won the website of the year from Modern Healthcare in 2017, I believe. And so that's obviously a huge nod to all the work that they've done, and all the different pieces that they've pulled together. We're very proud to have helped to support them in doing these great things digitally. So thank you, Lindsay, for walking us through that story. Some wonderful things there. For those of you who are listening, we have a couple questions that have come in already. Please feel free to use the Q&A tab if you've still got a question that you're thinking about. And in the meanwhile, I'll start with some of the ones that we've got already. And the first one actually relates to social media. So obviously you talked a lot about the website, but we had a question: how do you approach social media? Is that also sort of all pulled together, or do you have a lot of different social media presences for different elements of the system?
Yeah, that's a really good question, and one that we've put a lot of thought into. So since we have such a large geographic area that Avera covers, we have chosen to not completely centralize all of our Facebook and Twitter. Twitter we have fewer of, but Facebook we have a lot of accounts out there, just because, we did a study with one of our local colleges and their marketing team, where when we were first centralizing marketing, we said, what is the best way to approach this? Because we weren't really sure which direction to go and to take a hard stance on it. And really, we were finding that our traffic and our engagement was very strong on our local sites, so strong that we were worried that we would see a fall off if we went to one centralized structure. So to this date, we have not centralized all of our social, but we did put a lot of thought and had many conversations with our leadership teams around that. And there is still a want to have some local flavor and pictures and videos, and the things that perform really strongly on Facebook right now are kind of, we feel, best left local. It makes your social buying strategy a little bit more difficult, and really when you're doing boosting, so you have to have a very, very defined content strategy that you're working within to make sure you're not just throwing money out the window. And so our social media coordinator does a great job of being able to watch what's going out when, and really tracks those boostings to make sure we're not fatiguing our audience in such a rural state.
Makes sense. Makes sense. We have a couple of questions around engaging physicians and presenting physicians. The first is talking a bit about bio videos. So how did you get your physicians engaged? Was it hard to get them to agree to take the time to do some of this? And maybe just sort of more generally, what are you doing to engage providers so that when you come with an ask like, hey, we need a little bit of your time for something, that they're willing to do that?
Yeah, we show that the videos are really one of the strongest ways, as we do consumer research, that our patients are choosing their physicians. So we use that research for our benefit to really make the case that this is your new billboard. Your digital online experience is your new billboard. That's how people are going to choose you. And so we really did a big amount of work around phasing out traditional media and shifting our budget appropriately more to digital. And so part of that storytelling we did was with our physicians and our medical group leadership so that they really understood how people were consuming information and choosing their physicians. And so that made it easy for their Avera medical group leadership to say physicians will all have bios and they will all have videos. So they actually worked with us to make it part of the credentialing process as they're coming in and filling out that paperwork and their onboarding. Part of one step is that Human Resources actually brings them to our studio and we sit down and we shoot those bio videos. So it's not perfect, but most physicians are willing to do that and get a new headshot so that we have that on file. And then we just got a new videographer, so we're kind of working through the process of how often to redo those bio videos, but kind of our rule right now is every 5 years.
Okay. Wonderful. And are you doing some video content with physicians for Balance as well?
Yes, we have done some video content. Our recipes have kind of been the most popular one that we've tried. We've done some tasty type of videos and things, but we do shoot shorts sometimes with our physicians where we're like, give me one thought on tennis elbow or give me one thing that somebody can do to lower their blood pressure. And those really quick, like 15-second, 30-second answers are what seems to perform the best.
Excellent. We have another question about providers and highlighting providers. It gets a little bit in the weeds, so it may be better handled as a discussion rather than a Q&A. But the question is really asking, when someone has a marketable piece of their practice, and they use the example of a PCP who might be trained in acupuncture, you use the hepatobiliary surgery, whatever that was. But if they have something that you want to be promoting, how are you doing that? Or is there a category for both of those things that are being managed somehow? I mean, is that's still present in their profile somewhere? Yes.
It is. Yep. And so under our physicians' profiles, we take them to their main specialty, so that wouldn't be their main specialty more than likely, although we do have two physicians that just do acupuncture, so they're actually tagged to integrative medicine is what we call it. That's their actual specialty that it's listed under, but otherwise you would put it under an area of interest, like if you look at our bios and how they're laid out. So physicians do have the ability to have some personality there, but we do validate that information so that not anybody can call me and say, hey, I do liver surgery and I'm not just going to put that on the website. I work with credentialing and our team does a really good job of making sure that they are actually credentialed in that area that they're saying. So, yeah. But using the main AMA specialties for the American Medical Association helps us a lot to kind of develop that structure to what is their primary tagging for the website.
Yeah, tough area and a lot of work, and certainly, making sure everything's right, but also making sure that we're presenting docs as more than a medical degree and a residency is an awful lot of work, and I think you guys do that very, very well. We have a question about what content management system you're using for the sites.
Sure. So for content management for Balance, we actually challenged our team, and so we put together the team that works the most in Balance. So the writers, our social media coordinator, our director of digital, our media relations team, who are working and thinking about Balance, and our marketing coordinators. And we put together a work group, and I told them basically when we started this, I will buy anything off the shelf that you think works for you, or you can build your own tool. And so they've chosen to actually build their own tool out of Excel as a background, and it really works off of pivot tables and tagging right now, and that works very, very well. There may be down the line, we work in agency software also for our print products and things like that. So as those products mature over time, right now we use Workamajig as our internal work system for marketing. So as time goes along and some of those tools become more available in other systems, we may look to change. But right now, we're really just a year into deeply thinking from a strategic level about content strategy, and we're still in a building phase very much with making that all run cohesively. So this tool seems to work pretty good for us.
And the web content management system you're using, of course, is VitalSite,
Oh yes,
which is the
of course. Yep.
system we
Yeah.
provide as well.
Sorry.
No, that's okay. And I swear we that wasn't our question. Someone else asked that. Um, we did have one comment from someone that we used to work with at Avera a long, long time ago. Hi, Betsy. Just saying that she's glad that the Avera Green has been updated. So I can
Yeah,
give a nod to
Betsy,
that one.
you and I made a lot of those websites, I think, that we saw earlier. So that's kind of hilarious. But I'm glad you're on the call today and glad to hear from you.
Um, during the redesign process, how did you deal with dissension, particularly from physicians who want to create rogue websites, and maybe more generally? So how do you keep people from creating rogue websites? And then are there any parts of the enterprise that do have a separate web presence, and how do you draw those lines?
Yeah, that's a great question. Just to be clear, we still have some dissension here and there sometimes, so I don't want you all to think that I have it totally figured out. But we have 800 physicians, so it's always interesting conversations. But we basically made a hard rule early on. We had a lot of, especially orthopedic providers, some of their vendors offer them websites for free. And so we had this kind of rogue stuff happening where physicians were starting up like their own web pages. And so our administration was really at a point where they said, "You're right. We have invested the time and resources in Avera.org. That will be our source of truth. So you don't have to link off to these physician pages that are elsewhere. We will not link off to those. We will not drive traffic to those. We offer very little ability to link off to things. We have a lot of governance around that area of our website because we know it takes traffic off of our page. So that was really a place that we had to get to, but it was years and years and years in the making to get there, and to have our administration really stand behind us and say, yep, just because Dr. So-and-so wants this, we're not going to go this direction. And we've helped to tell the physicians that story too, so that they understand what is available to them on Avera.org. And like I said, we do have some dissension still, but as far as the second part of that question with what we allow to have different sites, it's very little that we allow to have kind of a spin-off site. Avera.org has to absolutely not be a solution for their issue. And so our health insurance companies have a lot of, governance that they have themselves, and certainly regulations and rules that they live within. So they each have a website, both of our insurance products, and then we have a telemedicine website because that's a totally different audience. That was why we decided to have eCare have their own site, and it was marketing going to them. It wasn't them saying, hey, we want our own website. We said, I think you need your own website because you're business to business, not business to consumer. And so that was an important realization for us as a marketing team to meet them where they were at, because they had a very developed sales team that is able to sell their products. So we did actually go to them proactively and say, I think we should offer you your own web presence. And then we also have an intranet, which is run internally, and it's actually hosted at Avera. So that's totally internal for our employees. So those are our web presence through Geometric.
Yeah, a lot of different moving pieces even still. We have a couple of different questions, and this is probably going to be our last question for today, but a couple different questions about source of truth for physician data. So you mentioned that you guys go out and verify that someone is certified to do whatever they claim they're certified to be doing, things like that. Is there a centralized source of truth? You mentioned Cactus, but is there a centralized directory like that you're pulling all that from? And then who manages most of that data? Is it med staff? Is it credentialing? Is it the PR marketing staff that's doing that? Where's all that coming from?
Yeah, it's definitely the marketing team that's managing it. And so our digital team does a lot of work. So our physician tool, I know I've talked to other health systems that their physician bios flow directly from Cactus, but since ours is a customized profile that we've built, we don't do that. So we actually have to put some manual work into making it work. But credentialing is flowing the information when we get new providers to us and when providers term from Avera. So they're letting us know when all of that happens, and there's a flow and a process that they go through with any new provider coming in, and we are part of that flow and process. So that team works inside of Cactus. We've done some training where we're familiar with how Cactus works and how that tagging works, and so our team has a depth of knowledge there too.
So you're getting a little bit from Cactus, but you're managing a lot of that data directly. You're not depending on credentialing to keep that all up to date in a way that you can just use.
Yep, exactly.
Yeah.
So that
Yeah.
means that works well only if you're very, very plugged in with your medical group. And we have an entire communications team that works within our Avera medical group. So that allows us to have, just this constant flow of conversation. So if that's not how it operates at your organization, you might need to look at some different tools.
Wonderful, wonderful. Well, thank you, Lindsay, and
Yes, thank you so
Yeah.
much for having me today. It was wonderful talking with all of you. I hope it was informational and you got something out of it.